So now, as you people know that there are 4 obstetrical grips, right? So coming now, you tell me what is this first grip which what is this? Quickly tell me what is this grip which I'm showing you now. This one. Yes. What is this grip? Excellent. Bhavani, Emuna, Shruti, every one of you are right. So this is the first one. This one is your fundal grip. Right? See. But before starting with your Leopold maneuvers, you need to remember few important points. Okay? So see here, before you starting with the examination, you will ask the patient, Madam, please go have your bladder empty and come. Okay, so bladder must be empty before performing this examination, and number 2, you are going to stand on the right side of the patient, and what position you are going to provide here before to perform this Leopold maneuver? Can you people tell me what is that position that you are going to provide? Yes, the position that you are going to provide is dorsal position with knees flexed. Okay, so the mother is going to lie in the dorsal position with knees flexed. Clear? Now, that is the position that you need to remember. Now, there, as I told you, yes, there are 4 obstetrical grips. And Suman sir, why should we perform this Leopold maneuver? What is the need? See, this Leopold maneuver is going to tell you, it is going to tell the lie, it is going to tell you the presentation, it is going to tell you the presenting part what it is, and the position what it is, and everything it is going to tell. Okay, right? Not the presenting part. It is. It will tell you lie, presentation, position, and everything. Clear? Now, don't ask me, sir, what is lie, presentation, position, everything. So everything I taught you when I have taken the labor class on my YouTube channel, it is still available. You can go watch it, right? Now, starting with the first obstetrical grip, that is your fundal grip. So coming, right, and next coming to the another one. So first let me list all the obstetrical grips and explain you one by one. Coming to the next one, can you tell me what is this second one? Tell me what is this second one? Yes, what is this called? Right, here the examiner hands are placed laterally, right? So what is this grip called as? It is called as excellent lateral grip or umbilical grip, right? So let me write it as umbilical grip. Next, coming to the next obstetrical grip, so that is, what is this? Here the examiner is using only single hand, and he is doing something. The examiner has placed the hand on the pelvis, and he is trying to do something. What in some time I will be explaining you everything. Okay, but now tell me what is this this grip? This is called as Pelvic grip. Very, very important. So very repeatedly asked question in exams. So if you see only a single hand which is placed over the pelvis and doing something, so that is your third obstetrical grip, that is your Pelvic grip, right? Okay, now, so why I am explaining you this, all this maneuvers is, this can be asked as image based questions, and definitely you are going to get one maneuver in upcoming exam. So I want everyone to give your 100% focus here now. Clear? So now coming to the last obstetric grip, right? So what is this called as? This is called as deep pelvic grip. So this is called as deep pelvic grip. Clear? Right. So now let me tell you one by one. Now what is this? Tell me fundal grip. Now tell me about fundal grip. So see here. Okay. So it seems funny, but yes, I only have this to explain you. Okay, I'll try to explain with this. Now, see here, now I'm talking about fundal grip. Here the examiner will take the hands and palpate the fundus and see what is present there, right? Now, there are only two possibilities. What are those possibilities? Either, this is how the baby is going to be there, right, in mother's womb. So now, see here, either the baby has to be like this or like this, right? Either the fundus, in the fundus, head should be there or buttock should be there, right? So, only these are two possibilities, right? There is one more possibility which I'll be talking in some time, but now think about this too. Suppose now you are the examiner and you are palpating the fundus of the mother and you are feeling the hard globular mass, which means the head, right? Okay, so head is present in the fundus, then the presentation will be podalic presentation. That means breech presentation. Okay, so buttocks are present in the lower pole of the uterus. So what is presentation? The fetal part which is present in the lower pole of the uterus is called as presentation. Okay, common sense. If head is in the upper pole, then lower pole buttocks will be there, right? So then that becomes the presentation, breech presentation, right? So suppose now the baby is like this, okay, right? So fundus, I could able to feel the broad and irregular soft mass. These are buttocks, okay. Now suppose the fundus is, you are palpating the buttocks, then that means head will be in the lower pole of the uterus, then that becomes cephalic presentation, right? So this is what your fundal grip is going to tell you about. So what it is going to tell you, right? Fundal grip will tell you about the presentation, whether it is cephalic presentation or podalic presentation. Clear? So it will tell you about the presentation. And Sumanth sir, only presentation is only can be evaluated with this fundal grip or any other finding also, right? You can also see lie. Not only presentation, your fundal grip will also tell you lie. Sumanth sir, how lie? So now see here, as I told you, either head should be there or buttock should be there in the fundus. Common sense, both are longitudinal only, right? Then lie means, then the lie here is longitudinal. Suppose, let's take, you are the nursing officer and you are performing Leopold maneuver, the fundal grip, and okay, you are doing the fundal grip palpation and there is no head and there is no buttocks. Pura fundal grip is empty. Then what it can be? What it can be? Empty pelvic grip, sorry, fundal grip. The baby is like this in the mother's womb. What is this called as? What is this position? What is this lie called as? If the baby is like this in the mother's womb, then what are we going to call it as? It is called as transverse lie, right? Okay. So now suppose if the fundal grip is empty, then that means the baby is in transverse lie. So this is how it is going to tell about the lie. So fundal grip will also tell you about presentation and as well as it is going to tell you about the lie, whether it is longitudinal lie or transverse lie. Clear? Okay. So now done with your fundal grip. Clear? So any doubts with your fundal grip? Shall I proceed with the other one? Any doubts with the fundal grip? Should I proceed with the, can I proceed with another one? Right. So next, coming to the another, right. So now, coming to the next obstetrical grip. So see here, the examiner is trying to palpate both sides of the uterus, right? So the examiner has placed the hands on the lateral side of the uterus. So this becomes your lateral grip, which is parallel to your umbilicus, right? So this is umbilical grip, right? So this is your umbilical grip, and what is your umbilical grip is going to tell about, right? It will tell you the position, very, very important. So how position? Always remember a thumb rule while performing the second obstetrical grip, that is your lateral grip. So spine leads to occiput. Clear? Right? So spine leads to occiput. Suppose the baby is like this in the mother's womb, right? So you will feel this curvature, right? The spine, right? And below the spine, what is there? Occiput, right? So now, so always think this is common sense. So if you are feeling that curvature part, okay, that means you are palpating the spine. So below the spine is your occiput, right? So that's how you will come to know the position, right? So now what is position? The relationship between the denominator, that is fetal bony prominence, with the maternal pelvis is the position, right? So now that's how you will come to know the position, right? I told you spine leads to occiput. So wherever you are palpating the spine, just below that will be your occiput, and now you can correlate, right? So suppose let us see here. Now this is the right side of the mother and this is the left side of the mother. Clear? And now, so see here, the examiner is feeling the C-shaped curvature towards the left side of the mother. Clear? So that means towards the left side is your occiput. So now you can think of whether it is LOA, LOT, या LOP. Okay, left occipito anterior, या left occipito transverse, या left occipito posterior. Suppose if it is towards the anterior, if the spine is towards anterior, think of LOA. If it is towards like middle, you can think of LOT. If it is if it is towards posterior, it becomes LOP. Clear? So that's how you will come to know about the position in umbilical grip. Clear? Right. So now coming to the next grip, very, very important, which is your Paulic grip. Now, so remember always the Paulic grip is done, here you are going to use your single hand and feel the Paulic grip. Clear? So what are you going to do actually here in Paulic grip is, you are going to check for something called as ballotment. You are going to check for something called ballotment. What is ballotment? You are going to check whether the head of the baby has fixed or not. Okay? Whether the head is fixed or not, that you are going to check in Paulic grip. Clear? So suppose if you can able to move the head of the baby, right? So here you will take your hand, you will place over the pelvis and you will try to hold the head and you will try to move it. If it is freely moving side to side, then that means ballotment is, head is ballotable. That means head has not engaged. If your head is engaged, then you cannot move it, right? So if there is ballotment, then that means head has not engaged, right? If head is right, if there is no ballotment, then that means head has engaged. Clear? Okay. And along with that, it will also, not only ballotment, it will also tell you the presentation, right? It will tell you the presentation also. How come? So head, if you are able to feel that hard globular mass, yes, it becomes cephalic presentation. It is also telling you the presentation here. Clear? And now, coming to the last one, deep pelvic grip. So what is this deep pelvic grip is going to tell you about? It is going to tell you about, yes, I have missed this one point. So take that point into your notes. Okay, see here, coming to the previous one, that is your Paulic grip. See, similar to your fundal grip, as I told you, if the fundal grip is empty, then you can think of transverse lie. Similar to that, if your Paulic grip is empty, then nothing you can able to feel. That is empty Paulic grip is, you can again think of the baby can be like, might be like this in the mother's womb. This is transverse lie, right? You can think of that. And now coming to the last one, that is deep pelvic grip. Deep pelvic grip is used to reconfirm the findings of the third one. Okay. So deep pelvic grip is to confirm the findings of the third obstetrical grip. Okay. Right. That is your Paulic grip. So it is to reconfirm the findings of the Paulic grip. Very important. Now see here. See, for first three grips, that is your fundal grip, umbilical grip and Paulic grip, your face will be facing the patient's mother's face. But whereas coming to the fourth, that is your deep pelvic grip, your face should be facing the feet of the patient, and you right, and then you will take your two hands and you will take towards the pelvis and you will check for something called convergence and divergence. Okay. Suppose if your hands are converging, that means head has not engaged. If it is diverging like this, if my hands are going like this, then that means the head has engaged. Clear? So that's how you are going to reconfirm the findings of the Paulic grip. Clear with the obstetrical grips? Your Leopold maneuver, very, very important. Okay, right. So now you should answer what is this. Suppose in tomorrow's exam, if they are giving you an image like this and asking what is this, now tell me, give me answer. Fataafat se give me the answer. What is this? Yes, Sadvika, tell me what is this? What is this maneuver? I am talking about maneuvers only today, right? So done with Leopold maneuver and we are here with a new image. So now tell me, what is this maneuver? Excellent. Kore Shrikant Yadav is telling that it is modified Ritgen maneuver. Devadas Dasari is telling Ritgen maneuver. Devi is telling Ritgen maneuver. Yes. So this is something called as modified Ritgen maneuver. Okay, modified Ritgen maneuver. Sumanth sir, what is this modified Ritgen maneuver? Now carefully listen to this. This is something which every one of you should know this, right? Why? Because it is something which is done in second stage of labor while delivering the baby's head. Okay, so what you are going to do is, so while delivering the head of the baby, so right, your WHO says that it is routine episiotomy is contraindicated. You cannot do episiotomies in all the cases, right? In all the cases of vaginal delivery, for every case you cannot do episiotomy, right? It is absolutely contraindicated. So what is your, instead what is your WHO tells you is, okay, my dear nursing officer, instead of going for episiotomies, go for something called as modified Ritgen maneuver. What is this modified Ritgen maneuver? The main aim is to prevent perineal tear. Okay. So here what you are going to do, okay, as a midwife, what you are going to do is, with one hand you are going to take a warm towel and you are going to compress the perineum. Okay, you are going to give the support over the perineum, and with another with the another hand, see the image carefully here. See, the examiner is trying to take a warm towel and they have placed over the perineum, right? And they are giving the perineal support with one hand, and with the another hand they will slightly flex the head and deliver the head by the extension. Okay, controlled extension. Clear? So they will deliver the head by the controlled extension. So this is called as modified Ritgen maneuver, right? So very, very important. So this is to prevent perineal tear. Okay, this maneuver should be followed in all the cases. That is what your WHO is telling. Okay, right. Now coming to the next image. Now fataafat se tell me, what is this? Now right, now very quickly you should tell me what is this. Where do we use this? What is this maneuver called as? Yes? Bhavani is telling Pinard's maneuver, Devi is telling me Pinard's maneuver. Kore Shrikant Yadav, okay, something which is used in breech presentation. Devadas, Pinards, Pichiamal, Pinards. Shan is telling me Pinards maneuver, okay. Sadhivika, Pinard. So every one of you are right, excellent. Yes, this is Pinard's maneuver, right? Now tell me, how is this Pinard's maneuver done, right? So this is, where do you do Pinard's maneuver? It is used in extension of leg. Okay, what do we call it as? Frank breech, right? This is something which you are going to do in Frank breech. And now you people will definitely ask me, Sumanth sir, what is this Frank breech? Okay, for that I am going to very quickly give you an outline on the types of breech now. So take the notes along with me. Okay, so these are the types of breech that you should know, right? Now see here, this one, the first one, see here, I'll see the first image. Here the baby inside the womb, the baby will be like this. The thighs are flexed and the knees are extended like this. The thighs are flexed and knees are extended like this. So this is if the baby is like this in the mother's womb, then this is called as Frank breech. Okay, so this is called as Frank breech. And now coming to the second one. Suppose if the baby is showing universal flexion, that means the head is flexed, the hands are flexed, and everything is flexed. So see here, the head is flexed, hands are flexed, thighs are flexed, knees are flexed, everything is flexed. If the baby is showing universal flexion, then that is called as flexed breech. So this is flexed breech. Next, coming to the third one. See here, what is coming out? Foot is coming out, so this becomes footling presentation. And what is coming here? The knee is coming out, right? So the knees are coming out, so then it is kneeling presentation, yeah, knee presentation. So close your eyes and answer to the examiner if they ask you what is the mode of delivery for footling presentation and kneeling presentation. It's always you are going to conduct cesarean section, you will not allow that for vaginal delivery. Clear? So forget about this two, and now let us focus on Frank breech and flexed breech. Okay, right. So in this case, so the maneuver which I have shown you the earlier, that everyone of you have answered it rightly, that is Pinard's maneuver, that is done for this Frank breech. Okay, so for Frank breech you are going to do something called Pinard's maneuver to deliver the buttocks. Okay, right. So see here. So done with the types of breech. So please have that in your notes. And now coming to the Pinard's maneuver. So how this Pinard's maneuver is done? So see here, the examiner is, see the image carefully. See the image carefully and see the how the examiner, yeah, obstetrician is trying to deliver the legs, buttocks. Okay. So see here, this is how the Frank breech, I told you, right? This is how the baby will be there in Frank breech. And now it's very difficult. Spontaneous delivery won't happen here. Now you have to help the baby, right? So to come out. Now what you are going to do as a midwife or as an okay, here you are going to take your two fingers and you are going to reach till the popliteal fossa, and you will just give the compression, and your leg will fall, the baby's leg will fall down, and you will hold the leg and you will deliver it. Similarly, you will do it for the another one. You will go till the popliteal fossa, you give the compression there, and the leg will fall and you will deliver it out. So that's how the buttocks will come out. So this is called as Pinard's maneuver. Clear? Okay. So again I'll tell you what is Pinard's maneuver. So this is done in delivering the buttocks. Okay. Right, buttocks and legs in case of your Frank breech. So here the examiner will take the two hands, the obstetrician, midwife is going to take your two fingers, and then you are going to give the compression over the popliteal fossa. The leg is going to fall like this, and you will hold it and you will deliver it out. Similarly, you will do it for the another one also, and this is how the buttocks will come out. Buttocks and legs will come out, right? Right. Now, this part of the baby will be out. It will be hanging like this, right? Now, so this is what is your Pinard's maneuver. Okay, completed. Now what you are going to do is, now okay, now buttocks got delivered. Now, as soon as the buttocks are delivered, what you are going to do, you are not going to, immediately what you are going to do is, you will take a warm cloth and you will wrap the baby. Okay, you will wrap the baby like this, and then only you are going to hold the baby, right? So you are going to hold the baby like this. Okay, why sir, why you should be using this warm towel and only holding the baby? Because what is there here, right? Umbilical cord will be there, right? It will be exposed to the outer colder environment and colder temperature, and also I told you in yesterday's class when I am teaching you the cord prolapse, right? You should not be touching the cord, right? Avoid excessive handling of the cord and don't try to manipulate, because it will further aggravate the vasospasm. And what happens? The blood vessels, the umbilical vessels will undergo vasospasm. The baby will not be getting blood supply. No blood supply, no oxygen supply, no oxygen supply. The baby brain cannot compromise for oxygen supply. Clear? And it will go under damage. What is that called as? It is called as HIE. Do you remember all this story which I was explaining you in my live class in app? Right? Yesterday's live class in app, right? Okay, so this is something called as hypoxic ischemic encephalopathy, and sometimes the baby can die. Okay, so that's why what you have to do is, you have to hold the baby using a towel. Clear? And only then you are going to support the baby, right? So now this part of the baby is outside, and now you have wrapped the warm towel, and this wrapping of warm towel is called as savage technique. This wrapping of warm towel, right? This is called as savage technique. Very important. And now okay, now I'm holding the baby's right, this part, and now your shoulders and the head of the baby is still inside. Your shoulders and also your head also should get delivered, right? And now to deliver the shoulders, what I'm going to do is, okay, I will hold the baby and I will be rotating the baby in 180 degrees both the sides. Okay, so that this shoulder will get delivered, and similarly the another shoulder. What is this? What is this maneuver called as? For the delivery of the shoulders, the maneuver which I am using, that is this one. Can you people tell me what is this maneuver called as? Excellent, Srikanth. Any other answers? Only Srikanth is watching the live. Be quick in answering. What is this maneuver called as? The delivering of the shoulders in breech. What do we use? Excellent. This is Lausset's maneuver. This is your Lausset's maneuver. Very, very, very important for the delivery of the shoulders. Clear? Now, right? So try to remember this. Again, very important image based question. So now your shoulders also got delivered. Now I will not be using this. Okay, right. Now the buttocks got delivered, shoulders also got delivered, and now the last part to deliver in breech presentation, remember, it will be the fetal head. Remember, in normal vaginal delivery, the first structure to get delivered is the head. Right, head will get delivered in normal vaginal delivery encephalic presentation by extension, right? So the first structure to be delivered in normal vaginal delivery is the fetal head. But remember, fetal head is the last structure to be delivered in breech presentation. Okay, so here I will not be using the word called head delivery in breech presentation. I will always use something called after coming head delivery in breech. Okay, because since the fetal head is last to deliver in breech presentation, so it is always you should use something called after coming head. Clear? Okay. Now how this after coming head is going to get delivered? It is not going to come out, right? Something you are going to assist the mother, right? So in what way I am going to assist is, see, now after doing this Lausset's maneuver, you will allow the baby to hang like this. Okay, still the head is inside the inside, and only this part is outside. Now you are not going to touch. Once you are done with Lausset's maneuver, then you will allow the baby to hang down like this by gravity. Clear? Now the baby is hanging like this, and still this part is inside. And now what you will do is, you will take your right hand and you will hold the baby's feet, and you will deliver it towards the mother. You will make a wide arc and you will take it towards the mother's abdomen. This is called as Burns-Marshall technique. Clear? Yeah, Burns-Marshall maneuver. So again I am telling you, here still the head is inside, and now you will allow the baby to hang by gravity. You will not touch the baby. Okay, now while the baby is hanging, and you will take your hand and you will hold the feet of the baby, and by making a wide arc you will deliver the baby like this towards you will take the feet of the baby towards the mother's abdomen by making a wide arc. Clear? And easily the baby's head will come out. The after coming head will be delivered. Okay, so this is called as Burns-Marshall maneuver. Clear with this Burns-Marshall maneuver? Right? Now, suppose if there is one more technique also. So this is, as I told you, this is Burns-Marshall technique. Yeah, Burns-Marshall maneuver. Clear? And now there is one more technique also to deliver the after coming head in breech presentation. Okay, if you are not going with Burns-Marshall maneuver, you can go for one more technique. What is this technique which they are showing here? Tell me. What is this maneuver called as? What is this maneuver called as? Tell me. What is this maneuver called as? This is called as modified Morrisseau-Smiley-Wheat technique. Okay, MSV technique. Modified Morrisseau-Smiley-Wheat technique. Clear? So how here in this case, what I am going to do is, okay, I will take my hand, I will reach the baby. See here, what is the obstetrician is trying to do here? Here he is taking the two fingers and placing over the malar prominence, and he is trying to flex. With one hand he will do this movement, malar flexion, and with another hand he will be applying the gentle traction over the shoulders, and he will be applying the gentle traction. This is how the after coming head will be delivered by, and this technique is called as Morrisseau-Smiley-Wheat technique. Okay, so again I am telling you, right? So here what you are going to do, you are going to place two fingers over the malar prominence, and you are going to flex the head of the baby, and with the another hand you will apply the gentle traction over the shoulders. This is called as malar flexion with shoulder traction. Clear? So this is your modified Morrisseau-Smiley-Wheat technique, yeah, MSV technique. Clear? Suppose if no maneuver is helping and still the head is inside and it's very difficult to deliver, then go for something called forceps delivery, right? There is a specially designed forceps for the delivery of the after coming head in breech. Can you tell me this forceps ka name? Tell me the name of this forceps, where the obstetrician will be going below the level of the, he will be kneel down, right? And then he will go just below the level of the baby, and he will apply the forceps, and he will try to deliver the after coming head in breech. What is this forceps called as? Excellent, Srikanth. This is called as Piper's forceps. So what is this called as? The specially designed forceps to deliver the after coming head in breech presentation. Yes, this is called as Piper's forceps. Can you see these forceps are curved? It is not straight, it is curved, right? Okay. So all this I think you should be clear, okay? Right, your Pinard's maneuver, Lauset's maneuver, Savage technique, Burns Marshall maneuver, modified Mauricio Smiley Wheat technique, and your Piper's forceps delivery, everything. You should be clear with this. And now, so clear till here. Should I need to explain? Should I need to repeat any topic? Yeah, maneuver here. I want everyone to be 100% clear. Your concept should be clear, right? It is not only by adding the images, just name and the images. No, never do that. It's very easy to remember, right? And they are very interesting also, right? So now tell me, Bhavani is clear. So any other students are having doubts, you can ask me. I will try to simplify even more. But I want you people to be clear. Clear, right? Okay. Right. So if you are clear, then I'll proceed with my next image. Now, fatafat se give me the answer for this image. What is this maneuver called as? Right? So tomorrow's NORCET exam, if they are giving you an image like this and asking you what is this maneuver that the obstetrician is performing, don't scratch your head at that time, and now you people should answer. Yes, what is this maneuver? Vale Murugan is telling Prague maneuver. Okay, is this Prague maneuver? Whether you are with, okay, so shall I log the answer? Shall I log the answer whether it is Prague maneuver or any other maneuver? Where do we do this? Okay, well, Murugan, tell me, where do we do this? What is the purpose of this maneuver? Bhavani is telling Prague maneuver, Devi is telling Prague maneuver. Okay. Pavani is telling me Burns Marshall. Why Burns Marshall, Pavani? Pavani, I think you are not clear with Burns Marshall technique, I told you. See, here in this image, the obstetrician is using both the hands, right? But Burns Marshall technique, what I told you, is only one hand, right? See here, whether you are seeing two hands here or only one hand. Okay, this is not Burns Marshall maneuver. Please go watch my video once again after the live gets completed, then you will get a clarity on what is actually Burns Marshall technique. And now, starting with this maneuver, what is this? Prague maneuver. Prashanti K is telling me Prague maneuver. Koresh Srikanth is telling me modified Prague maneuver. Okay. Alekia, no idea, sir. Okay. So, see here. Oh, okay. So this is, as you people told me, yes, this is Prague maneuver. Yes, those who have answered it as Prague maneuver, you people are right. This is Prague maneuver. Clear? Where do we do this? Again, it is done to deliver it is not done in shoulder dystocia, my dear Varlakshmi. No, it is not shoulder dystocia. It is done again to deliver the aftercoming head in breech. Okay, when the back of the baby, so this maneuver you will specially do when the back of the baby is posterior, right? Then you are going to do this maneuver to deliver the aftercoming head in breech. Okay, how is this maneuver done? So you will take one hand and you will grasp the shoulders of the baby like this. You will grab the shoulders of the baby, and with another hand you will hold the feet of the baby. Okay, and then you will gently, with you are grasping the shoulders, right? So you will gently apply the traction over the shoulders and pull it downwards. Okay, right? Gentle traction downwards, and with another hand you will hold the feet of the baby and you will take it towards the maternal abdomen, like how you do it in case of Burns-Marshall technique. Clear? Okay. So please don't get confused with Burns-Marshall technique with Prague maneuver. Both are different. Clear? Prague maneuver is different from Burns-Marshall technique, right? Clear? Okay. So again I am telling you what is this Prague maneuver. Prague maneuver is with one hand you will hold, grasp the shoulders of the baby, and with another hand you will hold the feet of the baby, and with where you are holding the shoulders you will just apply the traction over the shoulders downwards, and with the another hand you will be holding the feet of the baby and you will take it towards the maternal abdomen, like how you do in case of Burns-Marshall maneuver. So this is called as Prague maneuver. What is this used? Where do we use this? Again, to deliver the aftercoming head in breech. Clear? Okay. So now quickly coming to the next image. So now give me what, now tell me what is this? What is this maneuver? Yes? What is this maneuver called? Let me see who is going to give me the quick answer. Okay, everyone of you are clear, right, about Prague maneuver, how it is done and where it is done. What is an indication for Prague maneuver? Okay, so I think you should be clear by this time. And now quickly answer me, if you are getting in tomorrow's exam, if they are asking you this image, will you wait? So how come this is McRoberts maneuver, Well Murugan? No, this is not fundal massage. No. Kondal Rao Panditi, this is not fundal massage, or this is not a McRoberts maneuver. Where is the mother here? Mother's ka thighs are not visible, legs are not visible, and pura baby is outside and shoulders is outside. Then how come you are going to tell me that McRoberts maneuver? What is the aim of McRoberts maneuver? Where do we do McRoberts maneuver? To deliver shoulders. Here the entire baby is outside, only head is inside, right? So why are you answering McRoberts maneuver? So this is not. This is not something which you should think of shoulder dystocia. No, this is not shoulder dystocia. This is, okay, let me answer. So this is a push, no, let me tell you this. This is Bracht maneuver. Bracht maneuver. Clear? Sumanth sir, where do I do this? Again, it is done in case of breech presentation to deliver the aftercoming head in breech. In what type of breech? In frank breech. Okay, in frank breech. What is frank breech again? The baby will be like this. Knees, thighs are flexed and knees are extended. Okay, like this. In this case, you are going to do for the delivery of the aftercoming head, you will be applying this Bracht maneuver. And now you will ask me, sir, how is this maneuver done? Now clearly listen to this story. Okay, short story. Clear? Okay. Now the baby is going to be like this, right? Okay. Now, once till the umbilicus gets delivered, okay, so you will not be holding the baby, you will not even touch the baby. Once you see the umbilicus outside the introitus, then what you are going to do is you are going to hold the baby, right? You are going to hold the baby in such a way that your fingers should be there, your fingers should be present in the lower back of the baby. Okay, place your fingers in the lower back of the baby and your thumb fingers, okay, your thumb fingers over the thighs of the baby, that is the posterior thighs of the baby, and you will hold the baby like this. And then what you are going to do is you are going to maintain this position. Okay, you are going to maintain this position, and the baby ka body right, which is in your hand, you will take it towards the symphysis pubis. You will not just compress it, you will just take it towards the symphysis pubis, okay, of the mother, right. You will take the body of the baby is held towards the symphysis of the mother, and then due to the position which you have given to the baby, and the uterine contractions is also simultaneously happening, right. Due to this, the head of the baby will get delivered. The after coming head will come out. Okay, it will be delivered. If needed, you can ask one more assistant to give suprapubic pressure. This is not fundal pressure. Where is fundus here? Where is the fundus here? This is something called pubic, suprapubic pressure. Okay, right? Okay. Fundal pressure is you are giving pressure here. Here something over the pubis they are giving the pressure, right? This is suprapubic pressure. Clear? This is not fundal pressure. Okay, right. So think with common sense and try to answer. Okay, right. Next. Okay. So now tell me, I think everyone will quickly give me the answers. Now tell me, what is this? Right. Now tell me, what is this maneuver which here the obstetrician is trying to hyperflex the thighs and knees and take it towards the mother's abdomen, and they are abducting, right? They are taking away from the midline. That is abduction, right? So hyperflexion and abduction. What is this? And one more person is giving the pressure over the symphysis pubis, that is suprapubic pressure. Excellent. So this is McRoberts maneuver. This is not McDonald's maneuver. I've seen students answering me McDonald's maneuver. Since you go to McD very frequently, you should not be giving McD as an answer. Okay. So this is something called McRoberts maneuver. Right? McRoberts maneuver. Clear? So here what are you going to do is, you will take the very important, where do you do this McRoberts maneuver? In case of shoulder dystocia. And now, Sumanth sir, what is this shoulder dystocia? Shoulder dystocia means difficulty in delivering the shoulders of the baby. See here, can you see here the shoulders? The shoulders are stuck inside and it is not getting delivered. The difficulty in delivering shoulders is called as shoulder dystocia. And remember, behind this symphysis pubis, okay, so this is your symphysis pubis, this the bone, this one, your symphysis pubis. Behind symphysis pubis, the anterior shoulder, consider me as the baby, anterior shoulder, posterior shoulder. Okay, anterior shoulder is stuck behind the symphysis pubis. Now we need to do something and we need to deliver the shoulders out. Okay, right. Otherwise, again the baby will die. Clear? Okay. Now, what is going to happen here is, so very important, as soon as you notice shoulder dystocia, you will call for the help and you will bring the mother, mother's buttocks towards the edge of the table, and then you will empty the bladder of the mother. And should I need to do episiotomy in this case or not? Whether should I do episiotomy in shoulder dystocia or not? Tell me. Quickly tell me whether there is any need for episiotomy in shoulder dystocia management. Yes? Let me see who is going to answer. Okay, somebody is telling me Erb's palsy. Okay. Brachial injury, brachial nerve injuries. Yes, the most common complication of shoulder dystocia, brachial nerve injury, which I taught you, everything I taught you in anatomy. Okay, I taught you in anatomy, right? The policeman tip hand, right? Okay. forget about it. I'm not going to into the details of that. The topic gets changed. Okay, right. Excellent. You need to do episiotomy. Clear? You have to consider episiotomy here, right? And now what you're going to do is you will hyperflex the thighs of the mother and legs of the mother, and you will take it away from the midline, that is abduction, right? And you will ask one more person to give the suprapubic pressure. Clear? Simultaneously along with McRoberts maneuver, suprapubic pressure should be given, right? So that will help the shoulders to get delivered. Suppose McRoberts maneuver fails, then what are you going to do? Is you are going to go for something called rotational maneuvers. What are those rotational maneuvers? What are rotational maneuvers? You will insert the hand inside and you will try to rotate the shoulders. What is that? Internal rotational maneuvers. Can you name any? Can you name those internal rotational maneuvers? Any one at least? Any one maneuver at least? Can you people able to give me the name? So now see this. See the image. Okay. If you are not ready to give me the answer, okay. Tomorrow consider this as your examiner asking this image. What is this maneuver called as? What is this maneuver? There is something called Rubin's maneuver. Okay, there is something called Rubin's maneuver. Rubin's maneuver and wood corkscrew maneuver. Wood corkscrew maneuver. These are the internal rotational maneuvers. Okay, coming to the Rubin's maneuver, which is not done nowadays. Okay, so see here, I think the image is not clear for Rubin's maneuver. So here what you are going to do is, okay, you will take your hand and insert inside and you will try to flex the anterior shoulder, okay, so that this diameter gets reduced, right? So you will try to insert the hand into the vagina and you will flex the anterior shoulder of the baby so that this diameter get reduced, the biacromial diameter get reduced, and it will be easy for the delivery. This is Rubin's maneuver, which is less commonly done nowadays. The one which is done nowadays is wood corkscrew maneuver. Clear? Right? See, how do you rotate the screw? Similarly, you are going to rotate the baby also, right? Okay. See the image here. Can you see the image here? I think the image is given. This image is your wood corkscrew maneuver. This is your wood corkscrew maneuver. What is wood corkscrew maneuver? Remember, how do you rotate the screws? Similarly, you are going to rotate the baby shoulders. Here, you will take the two fingers of your right hand and you will insert inside, okay. You will hold, right, you will just place your two fingers of one hand over the posterior part of the upper shoulder. See here, can you see, right? Two fingers, posterior part of the upper shoulder, that is the anterior shoulder, and another hand ka two fingers over the anterior side of the lower shoulder, okay. So then I will try to rotate the baby in 180 degrees, right? So then then the shoulders will come in the longest diameters of the pelvis and it will be easy to deliver, right? Okay, again I am telling you what is wood corkscrew maneuver. You people will easily confuse between Rubin's maneuver and wood corkscrew maneuver. Rubin's maneuver, as I told you previously, you are going to insert the hand inside and you will flex the anterior shoulder and you will rotate it 30 degrees, okay, in case of Rubin's maneuver, right? You will flex the anterior shoulder of the baby and you will just rotate 30 degrees, and this is Rubin's maneuver. But what I told you, what did I teach in wood corkscrew maneuver? So it is done with two fingers only, right? Here complete finger, complete hand you are not going to insert, only two fingers you are going to use the both hands, right? one you're going to place behind the posterior part of the upper shoulder and anterior part of the lower shoulder, and then you will rotate the baby in 180 degrees. Clear? So that is your wood corkscrew maneuver, right? These are internal rotational maneuvers. If this fails, then the obstetrician will try to okay, then what the obstetrician will try to do is, so this is the anterior shoulder, this is the posterior shoulder, right? They will insert the hand and they will try to bring deliver the posterior arm. Then it becomes easy for the anterior to get delivered, right? The space will get decreased, right? So this is the delivery of the posterior arm if your wood corkscrew maneuver fails. And then even if that fails, then what are you going to do? Tell me. Even if all these maneuvers which I told you till here, all the maneuver fails, even the baby shoulder is stuck inside, then you will ask the mother to lie okay, lie on the forelimbs, okay, like dog or cat position, okay. So see here, the mother should come, should be lying on four limbs like this, okay, like the dog, yeah, cat position, okay, whatever it may be. Yes, so since mother is using the four limbs and having this position, so this is called as all four maneuver or Gaskin's maneuver. Very, very important, okay, right. The mother will be lying on the four limbs, okay, right. So this is all four maneuver or Gaskin's maneuver, and then you will try to deliver, okay. Even if your Gaskin maneuver fails, okay, even on this four limbs, it is difficult to deliver the shoulders. Now even Gaskin maneuver has failed. Now what should I do is, now I will try to, by this time the baby would be expired, okay. And now what you will try to do is, you will try to push back the head of the baby inside the mother's womb, right, into the uterus, and then you will take the mother to the operation theater and you will do cesarean section and deliver, right. So this pushing back the head into the uterus and then taking to for cesarean section, this is called as Javanelli maneuver. So this is the Javanelli maneuver. Can you see the head is pushed back, okay. So this is Javanelli maneuver. And now what is this maneuver? Again, this is something outdated, but it can be asked in your exams. This is called as Christeller maneuver. So just remember it for exam basis. It is no more done nowadays, okay, because Christeller maneuver is nothing but fundal pressure, okay, giving fundal pressure in breech, okay, right. We never give fundal pressure in breech presentation, okay. Suprapubic pressure can be given, but no Christeller maneuvers, okay, no fundal pressure. Always remember, never give fundal pressure, yeah, pull from below, okay, and you can give suprapubic pressure in breech, okay. Fundal pressure, this is outdated, not done, but I have attached this image for your reference for image based questions, okay, right. So there is something called HELPERR in shoulder dystocia that you people need to remember. This is HELPERR. Remember, it is very important. As soon as the you are facing difficulty in delivering shoulders, HELPERR protocol should start. Immediately, you being the nursing officer, you will call for the help. You need, so to provide McRoberts maneuver, you need two more persons, right? So one should be giving suprapubic pressure, another people will be holding the legs, okay, right. So you will call for the help, and then you will consider for episiotomy, and then you will give the first maneuver which is done, as I told you, in shoulders dystocia, it is McRoberts maneuver. Simultaneously, you can give suprapubic pressure, right? And then you will do some, if your McRobert maneuver fails, then you have to go for internal rotational maneuvers like your wood corkscrew maneuver, right, which are your internal rotational maneuvers. And then even if it is getting failed, then you will go for something called delivery of the posterior arm, as I told you. And even if that fails, then you have to go for roll the patient on the 4 limbs. Okay, that is called as Gaskin maneuver, yeah, all 4 maneuver, right? If even it fails, then you are going to push back the head into the uterus, and then you are going to take the mother and for cesarean section, you will do the cesarean section. Okay, that is Java Nelly maneuver. Clear? So I think you should be clear. Any doubts from today's class? We are done with the maneuvers, all the maneuvers in a single class. This will be helpful for it. This video is it will be truly helpful for your exams. For okay, maneuvers they are repeatedly asking. Okay, very recently also they have asked Prague maneuver. Okay, right. Even that I did not teach in the app. So right. So this video will greatly help you to clear your maneuvers from OBG. Clear? Your obstetric maneuvers, we are done with this, and very soon see you all in one more live class. Okay, right. If you have any doubts, you can ask me regarding today's class. Any doubts? Okay, if you have liked my lectures, okay, you can go through there are many lectures in YouTube which we have uploaded, so you can go through all those lectures. If you are really liking them, if you want to take the full course where I'll be sitting with you on explaining from anatomy, your first year subjects till obstetrics for your AIMS exam. Okay, you can download our app from from the Play Store called Medicine Nursing, and you can watch my lectures there. Okay, and those who are subscribing our 9.0 package will be getting the books for free. Okay, very recently I have released my books also, which are handwritten by me. Okay, so these books, 2 volumes you are going to receive. Okay, this is volume 1 and this is volume 2. This is volume 2. Volume 2 is for minor subjects and volume 1 is for major subjects. Okay, I have beautifully designed this, and that is going to really help you to crack your AIMS NORCET 9.2 exam. You can download our app from Play Store, and you can watch my classes there. Okay, so all the best. So see you all soon in one more live session. Until then, stay tuned and don't forget to subscribe to my channel and share to your friends those who are preparing for central government exams. And don't forget to comment. So let me know the another topic that I need to discuss in my next coming session. You can just comment it down, and I'll be uploading this class notes in my Telegram channel. You can access my Telegram channel by the link given in the description. See you all very soon, and till then, stay tuned. Good night.